Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
But there's a very excellent article about sleep and the dynamics of what happens during sleep and why sleep is so important. So if any of you get an opportunity, it'd be a good idea to look at that article. It talks about how efficient the brain is at, or used to be and should be, but gets less efficient at cleaning itself
Oh
out
no, I can't
during
hear.
sleep. And sleep plays a major role in the brain cleaning out its impurities and getting ready for functioning for another day. But anyway, it's a very good article that talks about the importance of sleep and why getting 7 hours of sleep is good for everyone. You want to start the show running, John?
Okay.
It also talks about the rise of esophageal cancer, which is something that, now this is an interesting article. Let's go back to that first one that you had, please. Because this is right in conjunction with the article that we talked about. You can do this every night to help prevent dementia. And you talk about what are the most valuable and reliable ways to protect your brain from dementia and many other elements. And it talks about many things, but when push comes to shove, what it is talking about, this mystery treatment, sleep. And among the other things it does, it's essential for anyone looking to avoid dementia. And this points out that sleep is a period when the mind and body shut down. We think that it is, but in point of fact, it's quite the opposite. It's an active period where tons of important biological processes take part. One of the most vital is memory consolidation. And many of you, when you sleep, you also have dreams, and you wonder what that's all about. But it's interesting that observation is that babies and toddlers sleep so long, and you wonder why they sleep so long. And this article suggests that it's because they're assessing new inputs and acquiring new skills, language and sociability, and all that sort of stuff. And it points out that in the little babies, they sleep 11 to 14 hours. We only require 7 hours, but it's interesting. And those who have obstructive sleep apnea aren't able to really have any good sleep, and that contributes to their increased risk for dementia as well. Now, of course, there are many presumptive studies. None of them are really good enough to really give you a real conclusion, although this study had 50,000 patients, and they had twice the risk of patients with insomnia, which means they didn't sleep well. They had a twofold increased risk for dementia, along with the prevalence of other diseases. Now, what is it about sleep that keeps our brains in tip-top shape? And it points out that how the fluid flows in around and flushes out toxic metabolic waste that accumulates. And that waste includes the beta amyloid, which is the protein that is thought to be one of the main drivers of Alzheimer's disease. So it appears that the cleansing out process is important that goes on with sleep, because there are many others who study sleep and the many phases of sleep, the deep sleep. But the bottom line is that in many ways, sleep is for cleaning the brain from the potential waste products that accumulate during wakefulness. And so that's one of the reasons why this brain waste removal pathway of the lymphatic system is more active during sleep. So I guess the point of it is that one of the most ways, one of the best ways we can prevent dementia is by having a good night's sleep. Anyway, we don't know as much about the G lymphatic system as it drains us as we would like to know, but it is interesting to observe that the lack of quality sleep is associated with the disease like dementia. He says sleep is the single most effective thing we can do to reset our body and our brain and body health each day, and it's the best effort at avoiding at getting health and avoiding the inevitable consequence of life, which is death. Any comments or thoughts about this article on sleep, which does not go into as deep detail as the Washington Post article, but it's pretty much in sync with it.
We have another article on sleep as well, Doc.
Dr. Callender, does that include naps, or is it just that long night sleep?
This is just long night sleep.
So do naps do you any good?
Yes, they should. There's evidence that naps are good. They should never be longer than an hour, but they are a good way to stay healthy. I don't know how many of you nap. I don't nap. My twin brother naps. Some people nap. It's supposed to be a good way to stay healthy. I just never.
What's the reason why naps shouldn't exceed an hour?
They felt it shouldn't exceed an hour because it interferes with your ability to sleep at night. So therefore, you should restrict it to 1 hour or less.
I don't nap on purpose.
Okay.
I do nap on purpose, Dr. Callender, because I just don't get a straight 8 hours sleep. Sometimes, some nights I do, some nights I don't. But when my body says, lay your head down and take a nap, it could be 2 hours.
I found that morning naps don't interfere with the long sleep at night for me, but afternoon naps may interfere with the long sleep at night.
Sylvia, question for you. It sounds like you're in a cycle. You take a nap, then you don't sleep at night. You don't sleep at night, so then you have to take a nap. So then after you take a nap, you don't get to sleep next night. So you're in a cycle.
It depends, John. I don't know what's going on with the retirement body I have here. Sometimes I can take a 1-2 hour nap and go back to sleep and sleep straight through. And then sometimes I can't. So I don't know. But, I thought as long as you got a good 8 hour combining late night sleep with naps was something that worked for you.
And for me, I never take a nap during the day. If I lay down during the day, it makes me nauseous. And a month or so ago, I was extremely tired and I had to take a nap. For 2 days, I just had to keep laying down. Took COVID test, I had COVID. So that was my symptom, extremely tired. Otherwise, I never lay down. Luckily for me, with COVID, that was the only symptom that I had, and I had to take a nap.
My situation is that being an entertainer, I'm up late at night on the weekends, but I'm accustomed to waking up in the morning at 6 o'clock. So if I get in at 2 o'clock in the morning on a Saturday morning, I tend to wake up at 6 o'clock. Well, I'll just wake up, I'll eat breakfast, I'll do whatever, and then go back and take a nap at 10 o'clock. But, that way I get enough sleep.
Okay, next article, John.
Dr. Callender, just one question. What about doctors that do not get enough sleep, or the health field, nurses and et cetera, when they got that 12 hours on or 24? How does this affect them, the sleep? Do they have more Alzheimer's or dementia than other people?
There's no evidence that that's the case, although your observation is accurate that healthcare professionals, especially doctors, their sleep behaviors while they're training at least is very poor. For example, they probably average about 5 hours of sleep during the training process. But so far, I haven't seen any data that correlates that with increased dementia.
Is that necessary where a doctor should work 12-hour shifts, or is that just tradition?
Well, the doctors don't, I think she was talking about nurses that work 12-hour shifts. Actually, doctors work 24-hour shifts. But they have changed it now so that you have limits on how long you can work. You can't work longer than 36 hours. And after that, you have to take a rest, and over a period of a week, you can't work more than I think 80 hours a week. Something, I forget what the number is, but it is all now quantified so that it's not as bad as it used to be, because there were times we would work 2 and 3 days in a row. Of course, that you can't do that anymore, and that's not healthy.
Still sounds pretty bad. So is it necessary or just bad tradition?
Well, that's an interesting question. It's past history now. So because now we have hours that require you that within a certain period of time you have to stop. So I think it may have just been tradition. Now, whether it's bad or not is another question. It wasn't bad for the patients; it was bad for the doctors, probably. And of course, there was some question as to whether it was bad for the patients, but time has not really answered that question.
Weren't
Yeah,
they prone to make more mistakes, doctors, if they're up for the second day in a row? Were they prone to make more mistakes?
Well, I don't know. I guess there's not enough evidence to say one way or the other. That was some of the thinking as to why they changed the working hours. But I don't know that there's a definitive answer to that question.
I know one question is that they have some kind of the same rules for airplane pilots. And so if the airplane pilots don't get enough sleep, it may be bad for those riding the planes.
Mm.
Okay, this article was deceptive in a way, because it points out that there are many factors that are associated with Alzheimer's disease and the related dementias. And of course, high blood pressure, low physical activity. Go back up, please. Yeah, and obesity. Those are three things that are risk factors for Alzheimer's. And so it is important to therefore address all three of those. Medications or other things may affect hypertension. Of course, low levels of physical activity are usually able of being changed unless you have some other disease which sometimes limits physical activity. Then obesity, of course, is another aspect. And so this article suggests that those are the things that should be addressed in order to decrease the likelihood of Alzheimer's or related dementias. Because the overall term is dementia, whether it's Alzheimer's or not. And it talks about other associated hearing loss is another issue that they've associated with Alzheimer's, and as depression, smoking, and binge drinking. Yeah. So this is interesting observations, and that's all they are. Although we say that because we don't really have a real cure for Alzheimer's, and so therefore, I just thought that the best thing to do is to try to prevent it. And so that's why this article is focusing on addressing those factors that are associated with the dementias in order to do what we can't do with medication. So an ounce of prevention is always worth a pound of cure. So it makes sense to do what they're talking about. If you've had hearing loss, wear a hearing aid. If you're depressed, exercise and see your psychiatrist or psychologist. Then, of course, when they talk about the fact that the minorities have more risk factors than other ethnic groups, it's clear they have more of the stresses, therefore, and they therefore fit into many of those high-risk behaviors. It's interesting. This is all this is a retrospective review. So, but it does say that modifying those risk factors could delay or prevent 40% of dementia cases. So it's important to at least recognize that these are some of the ideas that we have about it, while we don't really know. We don't know 100% what causes it, or do we know how to treat it. Okay, any questions on that? Of course, the association of good sleep again is, we see that again, so. Okay, now this is an interesting article because we don't have universal health care. One of the things that happens is that people can't afford to pay all their medication. And especially in transplant, if you stop taking your medication, you lose the transplant. And we've had a number of people who, because of the fact that after 3 years, the transplant medications expired from being covered, who lost their transplants after they were no longer able to pay for the medications. And the transplant medications cost upwards of $10,000 a year. So it becomes important to recognize that the social determinants of health play a major role in our health, especially since we don't have universal health care. And this is attention has been therefore focused on how inflation and other things contribute to people not being able to pay for their medication. And often the reason the patient doesn't come back to see the doctor is because they haven't been able to keep up with the medications, and so they don't even bother. So this is an important social determinant of health that we have to address and do what we can. And there are a number of drug companies that will actually, if you can't afford to pay, they will actually give you the drug free. But you have to apply for it and go through an analysis of your social state, and also have a doctor's note that indicates that you need the medication. And this article just talks about the things to do. Now, as I've dealt with this in many ways. One of the ways is that we in the past would get all medications from patients who didn't need it anymore and give it to those patients who couldn't afford it. That was one way of doing it. And many of the patients would when they stopped taking the medication, they'd automatically come to us and give us the medication, and we'd give it to those patients who had difficulty paying for medication. Now, this talks about being polite and sensitive about disclosing financial status. And this is a nice way. Are you going to have difficulty filling this prescription today? Rather than saying, can you afford to pay for your medication? And ensuring that all financial disclosures are confidential. And here's the thing, when patients have trouble paying for a drug, you can get help from pharmaceutical companies in some instances. And so if you're persistent and really keep up with the patient lets you know that they cannot afford to pay, then there are programs that are helpful. And this provides a list of other programs that are out there that sometimes people don't take advantage of. And there are a number of programs that you can find. And this article details some of them. And some of the pharmaceuticals will let you interact with them, and you can arrange it so that you get your medication sent to you. That doesn't mean it's without cost, but and then there are cards that cover drugs that only allow you to get generic versions. Now, the generic versions aren't always the best, but often they are. But there's sometimes where the generic versions don't work as well as the others. There are different Medicaid and Medicare programs that allow you to get discounted prices, and this talks about some of them. When it comes between whether they're going to pay the electric bill or get the medication, many patients will opt for the electric bill for good reason. But so these are some of the issues that going down the line. I think it shows these are some of the things, but actually there are Walgreens and some of the other companies actually will sell drugs at a much cheaper price than other places. And so if you have trouble, you can actually check with some of these places to see if they have drugs at lower prices, including some of these that are listed here.
Dr. Callender, there's a commercial I've seen quite often on the television that a person comes up to the counter and they ring up the price for the prescription, and it's way high, a lot higher than what they're used to paying. And the cash register person says, "Well, have you tried this this program, Good RX," right, or something like that? I've always wondered about that. Is that a scam, or is that,
That's for real. Yeah, if you go down this article there, I think they point out some of those things. That's for real. There are programs that
This
That's
happened to me. I went to my pharmacy for a prescription a couple of months ago. I don't take a lot of medication. I have asthma, but that comes through the mail. And I had to get a prescription filled. And she said, "Oh, this one's kind of expensive, but you can do the good RX." And I'm like, "Excuse me?" She did it. It just took a few minutes. So she did it on the spot.
yeah,
So
yeah.
It
how,
helped.
how did
It
that work?
works.
Yeah.
You said she did it. What did she
The
have to do?
pharmacist did whatever in the system, and I have a card. It says good RX. I guess I can use it in the future if I need it.
Yeah, and that's, it's interesting that knowing how to beat the system becomes important. And if you have a
And I wouldn't have
pharmacist that
known.
isn't sensitive, then
Yeah.
that's a problem.
Yeah.
And so it requires to interact between the doctor, the pharmacist, and the programs that are there. Also knowing, I know there were Walgreens and some other, what's the big place that has the Medicaid? It may be Walgreens, but no, it's another one.
Walmart.
CVS, Rite Aid. No,
Walmart, that's what it is.
Walmart. Oh.
Yeah, they have a number of programs for drugs that much cheaper.
And this was at the grocery store, Giant Pharmacy.
Giant, yeah, but I think Walmart is
Yeah.
even better.
Walmart. Yeah.
The same thing happened to me also when I was getting a prescription at CVS, and the pharmacist, it was a prescription that cost a lot of money. I'm like, what? Anyway, she says, let me see if you qualify for certain programs. And it was the RX program. And I did get a card in the mail also. And the prescription was like $5 by the time they finished. I was surprised.
Yeah, so that really does work, John.
I have a question about transplant patients. Before you can even get a transplant, they make sure you're on the right insurance. So how does that affect transplant patients? I know their medication may still go up, but doesn't most of their insurance that you're required to have before a transplant cover it, or what?
Well, I think insurance covers 90% of people who need a transplant, but there's 10% for which there is a green screen. And if you don't have that coverage, they won't transplant you. So that there still is a green screen. And there are patients who are not transplanted because they don't have the insurance coverage for the medication. And if they find you don't have that insurance coverage, they do not transplant you. So that there's still a green screen that applies to maybe about 10% of, maybe 5 to 10%, might be close to 5%. But yes, that still exists. Fortunately, it's only 5% patients, but if you're one of the 5%, that's important.
And then
Is that it?
yeah, that answers that. Then there are other things, and maybe somebody else can tell me how it is. If something is too expensive, I have no problems with saying that's too much and I'm not going to pay that. But you were saying people were embarrassed because they didn't have enough money to pay for the prescription or something. Is that generally among people, when you're embarrassed, when you don't have enough money, you just can't say, I'm broke, I'm poor, I'm not going to pay that amount. I guess people are just get real shy when they can't. I don't know. I don't understand that.
Pride goeth before destruction, and the Holy Spirit before a fall. And that's true yesterday, today, and tomorrow. And false pride is the problem. Yeah. And many of us suffer from it.
I've
Okay.
asked the doctor for alternative when I've been given a medication that I say, is this absolutely necessary? Is there another medication or another thing we can try? And I've always been able to, get something else.
That requires what she mentioned, that you have to have to be able to admit that there are things you can't afford.
Right.
And so false pride gets in the way
That's
for a lot of us.
Now, I was thinking though, on the business side of it, how can a company survive, like that,
They can survive like that because there is a markup.
Yeah.
Yeah.
There's a
oh,
markup. And so what you pay for the drug is you're paying for many years of research and so forth and so on. So you're not paying necessarily for the absolute cost of the drug. You're paying for many other things. And so that markup exists. And so, and many companies can make billions of dollars of them off of medications. And therefore, for example, the transplant medication, I have one patient who's been on transplant medication for 22 years, and he's not paid a penny. So, and the reason is because they have made billions of dollars, so they can afford it.
Okay, that's not John Tatum though.
No, no, I have another patient I see who had no insurance at all, and he's had his
I know
transplant for
that's
22
true.
years.
Yeah, I know that's true. David had two other buddies. They called themselves Three Amigos, during his transplant life at Howard. And he would get upset. One of them was a DC resident. He never paid for his medication. We paid a lot, but this other one never paid. So
Yeah,
it varies, I guess, where
right.
you
If you have
live.
Medicaid,
Yeah,
it's supposed to cover it completely. And if
okay.
you
He
have
had
other
Medicaid.
insurances, it doesn't pay. And Medicare only pays for 80%.
Yeah. He always said he had the
20%.
hookup. We didn't get the hookup.
Yeah.
Yeah.
They tell you when you're first on the list for a transplant that the medication will cost $10,000 or more a year. And are you able to do this? You have to think about all that stuff, So you want to pay that extra money for life? Of course you do. So
I have a friend that getting cancer medicine, and he has some kind of foundation because his medicine is like $5,000 a treatment, and it's a foundation that's paying for his medicine.
Yeah. And different entities have different programs.
Insurance is important. When David needed his second liver transplant, I think at the time Howard wasn't doing transplants, or they weren't doing livers. And we thought we were going to Johns Hopkins, but our insurance company said that they didn't qualify or had some reason. And then there was an issue with going to GW. So they gave us a choice, going to Mount Sinai in New York or Duke in North Carolina. We chose Duke in North Carolina because we knew we were going to have to live there for a while. We figured it would be cheaper, and discussed everything with our insurance company. They, of course, paid for the transplant, but in addition, they gave us $10,000 because we had to commute initially until he got his transplant, and to help with the living expenses while there. So that was a big help. It was a blessing.
Yeah. Next slide, please. Now, this is an interesting perspective on what they allege is the simplest thing for weight loss. And it all depends upon who's talking. But anyway, this is an article that talks about a fasting method, that intermittent fasting. It talks about identifying foods that do not cause insulin spikes and that are not high in calories. This is what this gentleman does and recommends intermittent fasting, and that in the long run, he thinks that this is the best way to do it. And we've talked about intermittent fasting before, and there's some of you who actually do it. Some do it for the long haul, and some do it for, remember we talked about the Daniel fast and other fasts that people do. And this is one of them in which you exercise and you take in calories and therefore he thinks that this is a long-term way of fasting that works for him. I think there were many discussions when we had to talk about fasting before, and we all agree that fasting makes you feel better, and giving the GI tract a rest is very helpful. I think everybody, for most people, it's the calories you take in that causes you to gain weight. And so eating is the way it's done. Although there are people who will tell you they don't eat very much and still gain weight because of the basal metabolism rate. If you have a high BMR, is which the abbreviation, then you can probably eat more than somebody who has a low BMR. And there are diseases that cause a low basal metabolism rate, which means you would gain weight faster than somebody who has a high basal metabolism rate.
Dr. Callender, question. You know, I think the standard is 3 meals a day, breakfast, lunch, and dinner. So if you skip one of those meals, I guess that qualifies as fasting, if those 3 meals are your habit. But some people have a habit of only 2 meals a day. So when they fast, they're gonna end up eating only 1 meal in a day.
Yeah, well, there's a number of ways to do it, and you described 2 of them. Somebody do 1 meal a day, some do 2 meals a day, and some do 5 meals a day. So it all depends on how you want to do it. Any other thoughts or comments? Because I know all of you have different fasting ways of doing things.
Yeah, I remember a nutritionist told me 30 years ago or so that she recommended 6 small meals a day. And the reasoning was that if you do that, your stomach never gets empty. And when your stomach gets empty, your digestive juices are flowing in there, and it starts to cause issues inside your stomach. And maybe those are hunger pains. I was just wondering about that. And how do you not eat if you get hungry?
Self-discipline. Self-discipline.
Does it hurt your stomach to
No.
have the juices flow in without food in there?
No.
Well, one of the main things for hunger are cravings that you get from sugar, because sugar temporarily spikes your energy, but then for a longer period of time, it saps your energy, and you want to get some food in there to restore energy. But when you get off the sugar, when you get off the sugar, you can regulate your hunger a lot easier.
Well spoken. Yeah.
Fasting means not taking in food for how long?
That depends on what you want to do. There's some people who will only not, their fasting is, they will only drink things. Some people, they will only drink water. And some people will have fasting for 24 hours, some 48 hours, some 72 hours. And so it's a variation on the theme of fasting. It depends upon what your motivations are.
Yeah, if you have a lot of,
As you know, Jesus Christ and Moses and others fasted 40 days.
But they didn't eat, did they?
I'm sorry?
They didn't eat, did they?
That's what fasting meant to them, right?
So it's your definition, because it's got me discombobulated. I grew up thinking just like what they did in Bible fasting, and then someone said, okay, you don't eat until after sundown. To me, that wasn't fasting. So I'm trying to get a true scope of what.
Well, that is fasting. That is fasting. There's fasting for any period of time that you decide is what you fast. Some people, the Ramadan fasting is they eat at sundown. So that's fasting. That's their style of fasting. So it's not that they don't eat at all, that they don't eat until sundown. And then there are other fasts in which they don't eat anything. Then there are fasts where they drink water, liquids. So there are a number of reasons why people fast and the number of ways that they fast, and it varies. So that yes, there are fasts in which they eat every day, but they don't eat during the daytime. And they consider that a fast.
And so Dick Gregory, I thought he was doing the true fast. So maybe I didn't understand. I didn't know there were just different variations of fasting. That's all.
Oh, well, yeah, I grew up the same way. I thought that fasting meant you had at least 24 hours. But there's a variation, just like this intermittent fasting, which could be 1 or 2 meals or something like that. So it all depends on what your mindset is. The Daniel fast, of course, is a fast in which they don't really not eat at all. They eat different kinds of foods, but they don't do without food. But they have a specific type of food that they eat during that period of time, which is when Daniel and his group ate. They ate foods that were different from the other folks, the Gentiles, so to speak. And so that's the Daniel fast, in contrast to the some of the other fasts.
Yeah, I thought that was fake fasting. So now I know it's really true. I just thought all these people making up all these different type of things. I'm not going to eat apples, so I'm fasting from apples, or whatever they would say. And I would just look at them with a raised eyebrow, because I just thought they were just doing a whole bunch of stupid, somebody made some money and typed this stuff up and published it, and people bought into it, and they called themselves fasting, and they got bigger and bigger. They didn't lose any weight whatsoever. And I used to think, excuse me, Darryl, I thought all vegans were skinny. And then I went to this vegan restaurant and all the waiters were fat. So I said, well, they're not true vegans. But then I realized I saw something on television. Cows eat all vegan food, and look how big they are, and bulls. So then I realized just eating vegetables don't make you skinny or something like that. But Darryl probably will correct me later and tell me how and why, But anyway, I'm over that now. So anything you do is called fasting.
I didn't say anything you do. But there are variations of themes and types of fasting.
Yeah, I know one type of fasting. You're talking about the Daniel fast. Daniel fast is when you don't eat no more lions.
No more what?
lions.
In the lions. You don't eat any more lions when you're in the lion's den.
Oh, no comment. Okay, next one, please. Now, this is a interesting article on mass shootings, and I thought it was very timely because a lot of people are saying, well, it's all about mental illness, and that all these people who mass shootings is all about people who are mentally ill. And as this article goes on to identify,
That sounded like
mental illness is present all over the world. But why is it that the United States has 25 times the incidence of mass shootings than anybody else in the world? So it's more to it than mental illness. It's a lot to do with a number of factors, and one of them is the availability of guns, and not only that, the availability of war guns. You know, it's not that it's just firearms, but they have war firearms that people use, and so the availability of that has something to do with it. So does the pandemic and the isolation and the stresses and all that. So there's a number of factors, but to say that it's mental illness, I think is a big mistake. And I'd be interested to hear some of your thoughts about it. I think most people recognize that when you compare the United States to all other countries in the world, there's a reason why the mass shootings occur here and not in other countries. And a lot of it has to do with gun control laws. And anyway, what are your thoughts on it? Because I think this is a topic that is timely.
One comment that I want to make.
Someone,
Go ahead.
I want one of those.
Go right ahead.
someone coined the phrase "nation under guns."
Say again?
Okay. Wait a minute.
Didn't hear what you said.
I'm sorry. Can you hear me now?
Yes.
Okay.
I'm
Someone
having
coined the
problems hearing
phrase
everybody.
"one nation."
Couldn't hear that anyway. Maybe one person can just speak.
Okay.
Yeah, I was just going to say that there's something wrong with America. It's not just mental illness. There's more wrong than that, because if we have the highest amount of mass shootings, and we also have the highest amount of deaths due to COVID, and we have the highest amount of this and the highest amount of that, is something wrong with American society in general.
Well, one of the things that they don't talk much about, there's no question that gun laws are one of the factors. Also is our love for violence. Our movies and other things, they glamorize violence. And so it's a complexity of factors. Gun control is one of them. The other is, as you said, our society glamorizes shootings and those kinds of things. And so it's a complex, but it's not just mental illness, because mental illness is everywhere. But mass shootings are pretty much an American phenomenon.
And there's also an active social media that talks about race war, where you have things that happen like the Buffalo mass shootings of black folks in the grocery store. And just because you've got that active thing on social media about race war, that's not the last time it's going to happen. It's going to continue to happen. And, you know, like John was saying, we've got some problems in American culture. I was just reading where United States ranks last in healthcare outcomes among developed countries. We got the highest prescription drug prices. You have to game the system to get a fair price on drugs, on treatment drugs. It makes you wonder why the hell we still live here, why we're not finding somewhere else to live.
The answer is obvious because people think that they can't do better. They can't live better. They believe that. Now, in some instances, that may be true, but because this is a capitalistic society.
Right.
And so it thrives on taking advantage of people. Let's face it. And
White, I feel
Actually,
like white supremacy has something to do with it also.
well,
Yeah.
white supremacy is part of it. I mean, just as John said, it has to do with society. White supremacy is part of it, but it's not all of it. The other parts of it have to do with our glamorizing, you know.
We lost
beauty.
our moral authority.
So
yeah, I think that yeah, the whole country was based on that idea of the cowboy mentality, you know, bringing in the guns and, you know, and I mean, you know, a lot of people wanted to be cowboys, you know, go out and shoot up Indians, you know. I mean, the society is built on that. And then, you know, you add the freedom part to that where you can, you know, do whatever you want to do and you have a right to have a firearm. You know, that's a big part of it. You know, you have a right to have a gun walking down the street in a lot of places, you know. And you know, with that and the glamorization of being a cowboy, you know, I think has a lot to do with it.
states with the lowest gun death rates are those with the strictest gun laws. And the thing that is problematic is that these mass shootings involve war weapons, not firearms that shoot a gun that shoots 5 bullets or 6 bullets. These are weapons of mass destruction that people are saying they have a right to have, which I do not agree with.
Yeah,
Dr. Callender,
the automatic weapons.
yeah, when that law, the right to bear arms, was first written, the guns that they had then are, as you're saying, much different from they are now.
Okay,
Yeah,
got about 5 more minutes. So do we have another article?
it's the last one.
Okay. This is good to take out some of the mystery because we've talked about zoonosis, which was a term that is used to describe diseases that come from other species, zoonosis, and monkeypox viruses that which comes from rats and monkeys. And this talks about how it arose in 1970 from the Congo in Africa and how it's developed since then. It talks about the 2 types of the pox virus. And it's interesting that it's transmissible, as you see there, from the lesions that develop and that close involvement with people who have the sores results in the infection. And it talks about the sores that developed and the transmission from animals to humans and between humans is something that is not like the coronavirus because it's secretions, contact with secretions that it's primarily responsible for transmission. Fortunately, this is not very efficient, and so that's why they don't believe that a pandemic is likely to occur from it. This association with men who have sex with men is something that is a red herring, I think. But anyway, so it's important to know that it's disease that is associated with infective ulcers that have secretions that have the virus, which spreads the virus to other people. And this talks about the symptoms: fever, headaches, sore throat, followed by a rash. And these rashes are very much like smallpox, so that's why called monkeypox. And there is a treatment. It's interesting how smallpox vaccination is effective at preventing it, but smallpox vaccines are no longer available. So it is expected that these cases, although they're few, will die out if the transmission does not occur. In other words, you don't have contact between people who have the disease. So how do we get the contact from the animals? That's a good question. Because the first cases that they reported here, there was no transportation between Africa and the United States. So people were wondering, how did the first monkeypox cases come into being here? I mean, recently. In the past, there was the association with the Africa, but the recent cases, that has not yet been established. Any other comments or thoughts about anything we discussed today?
I noticed that on the YouTube in certain countries that they're bringing monkeys into their homes, making them pets.
Good way of getting the disease.
Yeah.
Yeah. Oh, I see Pearline. How are you? We haven't seen you in a while.
You're on mute, Pearline.
Well, yes, she wants to stay on mute. We can't hear you. Maybe she wasn't saying anything. Okay. Well, any